Welcome back. Dr. Cardi Taub with Cone Health Medical Group Heart Care is here. She's answering our heart health questions. All right, so earlier you mentioned that heart disease is the #1 killer of women. So are there certain things that increase a woman's risk that we need to be aware of?
So yes, we do have what we call traditional risk factors, what we already talked about with the high blood pressure, diabetes, the cholesterol, the smoking. But there are now non-traditional risk factors that we have to consider in women, especially women of childbearing age who've conceived and had the baby. So these things are when you have hypertension in pregnancy that transiently or just completely resolved by the time you have the baby, diabetes, or you have a baby that is small birth weight. It has been connected now to heart disease in women. So we are very vigilant with that, trying to make sure that women are aware. Secondly, women who have endocrinology dysfunction, something called polycystic ovarian syndrome or PCOS, also increases that risk because it causes diabetes along the line. People who, and then women who've had menopause either prematurely or maturely. But the biggest thing is women of childbearing age. It has not been very known about this information that their blood pressure high in pregnancy causes that. So it really is a factor we have to be considering now for heart disease in women, yes.
Okay. Are there signs and symptoms that are different in women that perhaps attribute to something else?
So we have traditionally added chest pain to the list of when you're having high blood, like if you're experiencing heart attack or something like that. But that traditionally is not what a woman may experience. Women's symptoms are very, very different, where you may just be tired. You know, you're not having that typical chest pain that they're telling you the elephant sitting on your chest is going to your jaw. No, it just may you may be tired, you may just be short of breath. So symptoms in women that have risk factors or not should really be important to go ahead and see a doctor or call someone and investigate what's going on, because that just may be your symptom and everyone's different.
So what are the signs that we should call 911 like now?
Clearly, the typical signs we are talking about with the chest pain, feel like elephant sitting on your chest is tight, you're short of breath when this is happening, it's going to your jaw. But if you know what your normal is, meaning that you know how you are every day, and you're feeling outside of that, and you just feel you're getting tired and it just doesn't stop, you're getting worse, you're getting short of breath, and you feel dizzy, my advice would be call 911. Be assessed. It's better to have you assessed than not, and be able to say you need to go to the hospital or you need to go to your primary doctor, and make sure you're taking care of that and staying home, because you never know how the symptoms could progress.
Yeah, I think a lot of people say, oh, it'll go away, or let me see how I feel in the morning.
That's one of the biggest problems that I face sometimes with my patients, and I tell them, I say, please call us early, because sometimes you think it's going to go away. Unfortunately, people have lost their lives over that. You want to make sure that if you're feeling not yourself and outside of your baseline or your normal, just make sure you call somebody, call your primary doctor, call 911, because it's really important. People have lost their life and you don't want to be a victim of that.
Right. All right. We've got about 1 minute. Let's talk about what's happening on Friday. There's a symposium that women should know about. They need to register. Tell us what we need to do.
It's so important. You know, 1 in 3 women are going to die from a heart disease. We just talked about that, the #1 killer of women. So we are actually excited here at Cone Health because we'll be hosting our 2nd annual Women's Heart Symposium. It's a free event. There's a link to register, mostly virtual. We're going to send that link, share with you so you can share with the viewers. We're going to be educating women about their risk for heart disease, that female-specific risk factor, what hypertension, high blood pressure is doing to you, what diabetes, what steps you can take to prevent those. So it's going to be a good educational event.
I have a real quick question. Do you have to be there from 9 to 4, or can you just drop in throughout that symposium day?
So ideally, the in-person is from 9 to 1, 1 to 3 is what we're doing our screening session, but you can register and be on virtually. So it depends on the person, and we have an agenda where they can be able to see what benefits, and you get more out of it when you're there all day.
Yeah, I get that. Okay. All right. So Dr. Taub, thank you so much for that information. We're going to put this online for you, including that link that's to that symposium. All you have to do is look in the To Your Well-Being section.